In this video, part 1 of a series of 3 videos, we're gonna talk about when it is not time to go to the hospital. Let's start. Hi Mama, welcome to this YouTube channel. Today we're gonna talk about signs and symptoms of labor and when it is most appropriate to go to the hospital or when it is actually not. First of all, follow your instinct, because if you think that something is not right, then of course it is always a good reason to go to the hospital. We're always there to help you and to let you understand a bit better what's happening to your body. Always probably better to call your assessment unit, your emergency room if you're not sure, and then try to go if the midwife thinks it is appropriate to go. Otherwise, once you know why these facts happened, then you are good to stay where you are and just enjoy and embrace the end of your pregnancy and all these things that your body is doing naturally. Number 1 thing that leads mamas to go to the hospital that is actually not a good reason to go: Braxtonix contractions. But what are they? It's actually very hard to give a definition to Braxtonix contractions because they're very different and they vary according to person. And some women might experience very intense Braxtonix contraction, almost like painful, like early labor contractions, while other mamas don't even feel it at all, or they might just feel it slightly. Braxtonix contractions are tightenings that your uterus does in order to prepare for labor. While proper contractions usually start at the top of the uterus and they squeeze down your belly and your baby, Braxtonix contractions happens on the side of the uterus, and they're kind of like irregular in frequency, intensity, length. They definitely not have a proper pattern, and they never evolve in something more regular that might be early labor contractions. They are uncomfortable. I would not say they're painful. Some women do define them as painful, but again, it is a pain that you can go through while simply having a warm bath or changing position or empty your bladder or drink a good sip of water. It is actually possible to trigger Braxtonix contraction if some of these events happens, like having a intercourse, having a bladder fall, being dehydrated, or just being uncomfortable maybe after a long walk. So there are contractions that you can control and trigger according to what's happening to your body and with your baby. Sometimes also big baby can trigger Braxtonix contractions, or the fact that you have a lot of water, a lot of amniotic fluid that kind of gets your uterus very tense and big. Those facts can actually trigger Braxtonix contractions. It is not a reason to go to the hospital. They do not do any harm to you or to the baby. Just take it as a sign of preparation that your body is doing. How can you differentiate the Braxtonix contraction from early labor contractions? The only sure way to differentiate this contraction is through a vaginal exam, because Braxtonix contractions don't do any change to your cervix. If you're not sure what I'm talking about, make sure you check the video where I explain vaginal examinations and what happens to your cervix. But generally speaking, you don't need to have a vaginal examination to understand whether you have Braxtonix contraction. If you're actually asking this question itself, it is an answer to you that they're not early labor contractions, but they're simply Braxtonix contractions. Another super frequent reason to bring mamas to the hospital when there is actually no need to is the mucus plugs. I don't know how many times I've received calls describing this event that happens to your cervix. Again, I really appreciate the calls instead of coming to the hospital, because again, we want to keep you outside the hospital as much as you can, especially if you're having a healthy, low-risk pregnancy. There is no reason to be in the hospital earlier, especially you don't want to bring more interventions, you don't want to stay longer than you have to in the hospital. No one likes it. You're so much better at home, and being in the hospital just brings more intervention where you can easily avoid them just by making a call or by watching this video and being aware about, for example, what a mucus plug is. What it is kind of hard to describe. I would say is like a plug. It is an egg white sticky glue that you might see in your underwear. This usually happens a few days before labor, but we have loads of women reporting it happening even 2-3 weeks before labor. It is a protection that your body produces and locates in your cervix to protect your baby from the bacteria that are in your vaginal environment. Those bacteria are there for a reason. They keep your vagina healthy, but we don't want them to go up to the womb and possibly cause infections. That's why the body produces this substance of this kind of plug. With the changing that happens in your cervix during the last weeks, the facing, the stretching, then it might be possible that the plug kind of dislocates itself and you can see a piece or all of it in your underwear. It is usually transparent. It might be slightly yellow or brownish or a little bit pinkish because there are some vessels in the cervix that they might break while your plugs comes out. So it is quite common to see it being pinkish. But this doesn't mean that there is anything going wrong unless it is bright red, and of course when you see bright red in your underwear, you have to go to the hospital no matter what. But more on that on part 2 of this video. So mucous plug, no, not a reason to go to the hospital. It is great that you're losing the plug. You might see more, you might not see it at all. We don't care. Now let's go to nasty symptoms that you really want to get rid of, but unfortunately are not correlated with the start of labor. We are talking about diarrhea, nausea and vomiting. I'm not referring to the first trimester vomiting and nausea. That sometimes requires medical attention because you can get quite dehydrated quite quickly. If you are getting a bit of nausea and diarrhea towards the end of your pregnancy, towards your last weeks, it is actually quite normal. It's simply your body doing a kind of self-cleaning, self-cleansing in preparation for the birth. Of course, you'll be able yourself to differentiate this kind of diarrhea from a more serious diarrhea that requires attention. For example, if you have food poisoning or if there is something going on that you don't understand, you might be getting a flu, then you want to give a call to your provider and make sure you're not getting dehydrated and you are doing what you can to let these uncomfortable symptoms finish. But otherwise, if it's just like an episode or two, totally normal. There's nothing that can be done. Another sign that your body is preparing properly for labor. Backache can be a quite uncomfortable thing to experience. Sometimes why I see women coming to the hospital for backache because it's that they think that is the start of labor. This pain kind of reminds the menstrual cramps, and it might be mixed with Braxtonix or confused with early contractions. Usually it's simply linked with the fact that your baby has dropped again in your pelvis and he or she might be turned not in the optimal position for labor. So you want to adopt leaning forward position. You want to have massages, put a hot water bottle in the area. Just try to ignore it and hopefully it will go away or it will lead into more proper labor contractions. Last but not least, your baby has dropped. Well, I did another full video on this particular event because I find it quite interesting, but it is not a sign of labor. It might give you a definitely urge of nesting because you feel so much more energy suddenly. You can breathe better, you can eat better, your baby is more down in the pelvis so you don't feel this constant weight here under your lungs, and you might have this sprint of energy. It might be also accompanied by a change in your behavior, in your mood. Again, all good signs that baby is getting ready with you to prepare for these big events. That's all for this video, mama. Make sure to follow me into part 2 of this series. See you there.